Hey everyone, Mark here from Off Grid Medic. Thank you for tuning in. Today we're going to talk about moulage. Moulage is a French word, and the literal translation is it is the use of visual enhancements to reinforce medical training. So for any of you who have taken our programs before, you are very familiar with what moulage is. It is an extremely effective way to reinforce skills that you've learned in our programs. As a professional rescuer, there is nothing more frustrating than walking up to a patient, I say patient, a patient on a exercise or during a drill or a training operation, and you walk up to your patient who's laying there on the concrete where it's nice and dry, and they pull out a 3x5 index card and they say, "My name is so-and-so, my injuries are as follows," and then they read everything off of there. I'm sorry, but people do not learn that way. People learn visually. So because of that, in our training programs, we always use live crisis actors, and we use very realistic looking moulage. So this is a really big topic. I'm going to break this down into 6 different videos. Today we're going to learn about lacerations. This is our Off-Grid Medic moulage kit right here. We like to refer to it as the box of pain. Some of our students, former students that are watching this, they will refer to it as the box of nightmares, because we can do all sorts of extremely realistic looking things. But just wanted to break this down for you today and show you how we actually build these theatrical enhancements. All right, so what we have is we have our proprietary mixture that we use, and all we do with this is we apply it directly to bare skin. Notice there's no injuries or anything here. We just apply that directly to bare skin, kind of feather it in a little bit, and then we make our laceration right through the center of that. Kind of feather the edges. Then we come in with a darker color. And what this darker color does is it actually gives depth to the injury. So we're going to take that darker color and there we go. I'm just going to put some of that darker color in there. Kind of feel like Bob Ross whenever I do this. So one of the reasons why we use crisis actors is because in an emergency situation, you are not simply treating injuries, you're also treating the patient. And that patient is not always going to be calm, cool, and collected. It also, by using this method, it also allows us the opportunity to induce a significant amount of stress with our students. We are firm believers that you fight like you train. So if you train soft and you ever need these skills, people tend to fall back to their lowest level of training. So you see we've added some black, now we've added some red, and that's going to be our main laceration there. Now it's just a matter of feathering this in a little bit. And again, it is a proprietary mixture. We've tried several of them over the years. A lot of this we've actually just developed on our own, self-taught on our own. So we have that. And then now it's really time to make it pop. So we just take a napkin or a paper towel. And then now we actually have something that looks like a really nasty laceration. Again, nothing worse than showing up on an exercise where you paid good money to learn something and you really don't see anything. So you're dealing with, whenever you take our programs, you're dealing with patients who, if they have a laceration, it's actually going to look like a laceration. If they have a swollen, deformed extremity, possibly fractured, it's actually going to look like that. So you can kind of see how this all comes together here. And then our final touch is just adding a little bit of good old-fashioned fake blood. And believe it or not, the more it drips, the more realistic it looks. So there's our fake laceration. See how it runs down the arm like that? That's even better. That's shock value right there. What we're trying to do is we're trying to induce tunnel vision, and we're also trying to induce adrenaline into our training. Tunnel vision affects everyone differently. Adrenaline affects everyone differently. It's absolutely critical that you learn how your body reacts to that so that you can respond to an emergency in a calm, cool, collected manner and go in and make order out of chaos. So thank you very much for tuning in. Like I said, this is going to be part 1 of 6. And until our paths cross again, thank you very much. Thank you for the likes, the comments, the shares, and of course the subs. Tell your friends about us. We've got we got a lot more really good stuff coming your way. Thank you again. You guys have a good one.